Can cholesterol testing be done without fasting? Have you ever wondered if you need to fast before getting your cholesterol tested? This is a great question, and the answer has evolved over time. Cholesterol testing is a routine procedure that helps assess cardiovascular health. Traditionally, doctors recommended fasting for 9 to 12 hours before the test. This is because eating can temporarily raise triglyceride levels, which can affect the results, especially the calculation of low-density lipoprotein, often called bad cholesterol. Fasting helps ensure that the cholesterol and triglyceride measurements reflected your baseline levels. This way, the results are more reliable for diagnosis and management. However, recent studies and updated guidelines suggest that many people may not need to fast before their cholesterol tests. In fact, non-fasting cholesterol testing is becoming more common, especially for individuals who do not have significant cardiovascular disease or risk factors. Non-fasting tests can still provide valuable information about total cholesterol and high-density lipoprotein, known as good cholesterol. These levels are less influenced by recent food intake. Some research even indicates that non-fasting triglyceride levels can help predict cardiovascular risk, although very high post-meal triglycerides might requiring a follow-up fasting test. For individuals with hyperlipidemia or those being monitored for specific lipid disorders, healthcare providers may still recommend fasting. This is particularly true if accurate measurement of triglycerides and calculated low-density lipoprotein is necessary. Fasting helps minimize variability and ensures consistent results over time, which is crucial for treatment decisions. It's also worth noting that not all cholesterol-related tests requiring fasting. For example, the lipoprotein A test, which measures a specific type of cholesterol particle linked to increased cardiovascular risk, does not need fasting. This highlights the importance of following your healthcare provider's instructions based on the specific test and your health situation. In summary, while fasting has been the traditional approach for cholesterol testing, non-fasting lipid panels are increasingly accepted for many individuals, especially for routine screening. However, fasting may still be necessary for certain patients, particularly those with hyperlipidemia or other risk factors. Always consult your healthcare provider to determine the best approach for your specific needs. This will help ensure that your cholesterol testing is tailored to your health status and provides the most useful information for managing your cardiovascular risk.